Hey, it's Dr. Dan, and I wanted to give you a quick update on my situation. And I have to say right up front that we are so grateful for all of the support, financial support, the cards, all the love that's come our way. I can't tell you how much we appreciate it and how grateful we are for everybody's support. And so I thought it'd be good to give a little update of my situation. And of course, you know that I started to get some pretty severe pain. It's so bad I could hardly get up from a sitting position without help. And I was afraid I would fall. I was so weak. And I knew I had a serious problem. So I ordered myself a PSA test because I was suspecting maybe that it was prostate involved. And my first test that I took came in at 1,500. Normal is 1 to 4. It was off the charts. So I knew I had a serious problem. And so I wanted to have a metabolic, non-toxic approach to my problem as much as possible. And I was fortunate to connect with a doctor out in Arizona. He was very gracious. I had 3 phone consultation with him. He's a MD. He's has several PhDs. He's a cancer research scientist, and he's the head of a metabolic clinic out in Arizona. And so we had a conversation, and the first thing I told him was, I said, the prognosis for my condition, life expectancy is 2 to 4 years. I said, I don't like those odds. And he said, well, we don't talk about years. He said, we talk about decades with your condition. I said, you mean to tell me that some of the patients that have what I have lived 10 years? And he said 10, 20, some 30. He said, this is treatable with our program. And I said, well, okay, sign me up. And he said, I'd be glad to. I said, what does it involve? And he said, well, you'd have to come to Arizona for 6 weeks. And then there's a 1 1-year follow-up, and which you have to come periodically as a follow-up. And I said, what does it cost? He said, $72,000. And I said, oh, Doc, I can't do that. And he said, I understand. He said, a lot of our clients are celebrities and wealthy people. So he said, I understand. He said, but let me tell you something, Dan. He said, my dad was also an MD, and he had a philosophy which I have also adapted, which is if we have something that can help a patient and they can't afford it, we at least have the obligation to give them the knowledge. So he said, I'm going to send you 5 things that you could probably find in your own area to get started on to see if you can put the brakes on this cancer. And he said, these are some of the main things that we do in our program. And so he sent me an email, and there were 5 things. One was ozone IV. One was high concentration vitamin C IVs. He mentioned several supplements that I should start with, and one repurposed medication called DCA. And so I started on those right away. I also then right away made an appointment with a urologist. It took me a couple weeks to get in, and when I got in, the urologist did a complete blood workup on me, and I found out the results on that 2 weeks later, or 2 days later, and I had been on the metabolic program for about 2 or 3 weeks, and it had already dropped, my PSA had already dropped to 850, so that was encouraging. And the urologist recommended that I get a high-tech 3D prostate-specific MRI. So I scheduled that and the blood workup. And so I went in for the MRI. Oh, he also recommended that I see an oncologist. So he made a referral to a special oncologist in Houston that he that he knew. So I had another appointment with the oncologist. But in the meantime, I went in for the MRI, and remember, I was still in quite a bit of pain, and I was still sleeping in my easy chair because I couldn't lay flat on my back. So I get in for the MRI, and I got to lay on a metal table on my back with my hands pulled up over my head and strapped down, and then slid into a tube for 45 minutes. So it was brutal, but I endured. I got through it. I hope I don't have to do it again. But several days later, we got the results of the scan, and it was disastrous. Both Diane and I cried when we read the report. The cancer had spread throughout my bones in multiple areas, and it was devastating news. So I started to study. I've read 6 different books now on metabolic treatments for cancer and gotten a lot of knowledge on it. And I went and saw the oncologist, and he recommended that I get a PET scan and also a CT scan, which I eventually got both of those. And he also recommended that I take a antigen blocker to knock down the testosterone levels. I had some apprehension about that because there are some risks, some side effects with that medication, but the doctor said that the risks, he said we weigh rewards versus risks, and he said he thinks the rewards would be better than the risks, and so I decided to do that, so I've been taking that. Since then, from all my studies, I've also added 2 other repurposed medications. I was so surprised. I did some study and brought down some papers from PubMed and found that some of these old medications, there were multiple peer-reviewed studies showing excellent results with cancer, and I was surprised nobody talks about these things. But some of these repurposed medications are inexpensive, and I was able to buy them online. And I don't know, there's probably some politics and finances in cancer. I don't quite understand it, but in any event, I started on on this metabolic program, and I was retested again. My second time, my PSA was 550, and then just a couple weeks ago, after about 7 months now, I had it retested again, and it was 230. And my oncologist's office called me and said that doctor said I was doing extremely well. And so I'm so thankful. The program I'm on, it seems to be successful. I don't know if I'm going to defeat this or not, or how long I'll be able to have success. But one of the challenges, of course, is that none of these things are covered by insurance. So my metabolic program costs between $3,000 and $4,000 a month. So, I'm on a fixed income right now, so this is not sustainable. But I've been thankful. So far I've been able to follow through. I know I've got a journey ahead. So again, I just so much appreciate the support, so much appreciate the love and the cards, and especially appreciate the prayers. I believe there's power in prayer, and I've been asking the Lord for guidance and for healing, and so I really appreciate everybody for the support and prayers. So thank you so much.